before I say good morning to the clinical child psychologist, friend of the program, is Dr. Janine Hubbard. Dr. Hubbard, you're on the air.
Oh, good morning, Patty.
Welcome back to the show.
Oh, listen, thanks for having me and talking about this really interesting study that's come out.
Really interesting and really troubling. I mean, there was a big cohort studied inside of this, adults that have been diagnosed with ADHD. Let's start with the expected lifespan. So we're talking about, for males, I think it's almost 9 years less life expectancy for males, or
about 7 years for males and 9 years for females.
Right. I didn't drag the story up quick enough. Go ahead.
Yeah, no, that's okay. Because trust me, I've been delving in. Is the idea that they're finding from this study or suggesting is that there's a significantly decreased life expectancy for individuals with ADHD. I mean, obviously, these are people who have been previously diagnosed and have since deceased. So in terms of the age range and, some of the presenting issues, I'm hoping we've moved forward from some of it, but it certainly shows a focus that we need to both, A, be making sure we are not dismissing and, dismissing concerns from people who are saying, hey, maybe I do have ADHD. We need way better funding for it. But also, a lot of these are measures that can be addressed if people are aware of it. So if you're aware that you have ADHD, and we know that these are some of the factors that can shorten your life, it's being proactive about trying to address some of them.
It's suggested that the vast majority of adults that have ADHD are undiagnosed, which is a complicating factor here. And I'm not trying to dismiss any of the findings because I want to dig into them. But one thing that was not part of the study is how people died. I don't know how important that is, but that was not included, whether we talk about risk associated with their addiction or suicide or those types of things, which I think are important components. And that's not in an effort to dismiss the findings because they're extraordinary.
No, and I think we've long known about some of those types of issues, addiction issues, accidents, suicide. So a lot of that we have always kind of known. What this was picking up on is more kind of the secondary impact. So things that are specific to ADHD that are then more likely to increase obesity, that are more likely to increase blood pressure or diabetes risk, or so that there are some very unique factors in ADHD that can contribute to those larger chronic health issues. Also, some of the social determinants of health, so things like poverty and unemployment and, even things like suggesting, well, you know what, people with ADHD often get lost to follow-up. So if they've got a chronic physical condition that doesn't receive the regular medical attention that it should, you're more at risk of those complications. So it's looking at how some of the factors that occur in ADHD are then intersecting with chronic health.
Yeah, because they make reference to, I think, what they call co-occurring mental and physical health conditions. Mm-hmm. So let's get into the modifiable risk factors. So I wonder why it's different in the community that is ADHD, but when they talk about modifiable risk factors, what are we identifying and what are we not doing?
Okay, so two things. One, we definitely have an underdiagnosed adult population because in theory about 5 to 9% of kids have ADHD, but yet at the moment we're saying only 3 to 5% of adults have it. Some of that dates back to several decades ago when we thought that kids outgrew ADHD. We know that's not the case. The symptoms shift and change and have different levels of impact. And we weren't diagnosing girls and women in ways that we now understand. But what we're really understanding is it's so much more than the hyperactive 6-year-old boy getting up on the desk at school and poking the kid sitting next to him. What we're seeing is it could be things, for example, ADHD is all about seeking the dopamine hit. It's all about kind of getting that sensation-seeking good feeling. So it means that individuals with ADHD are more likely, for example, to rely on junk food or takeout. Again, the alcohol, substance use, we know that that's higher. We also know that It can even be things like hyperfocus, which can be a great skill, but there's a tendency to develop some time blindness where you're so focused on what you're doing, you're not noticing kind of what else is going on, including sometimes paying attention to your own physical symptoms. So all of a sudden, out of nowhere, you realize, I haven't eaten all day, I am famished, and you go for the bag of chips that's on the counter because you're too hungry at that point to go and, nicely prepare a balanced meal. And sometimes just the organizing and planning that goes into something like balanced nutrition can be a piece of it. There's a preference for more sedentary activities. So individuals with ADHD may be less likely to engage in, physical activity. All of those factors that we know can be part of overall physical and mental well-being.
And some of that hyperfocus leads to very distinct and things we can all be individually aware of is if you have a wicked time with time management and missing deadlines constantly, it's just, I think, indicative of how wide and broad ADHD is, right? So,
and listen, no two people with ADHD look alike. There's no question. But we also know the rates of unemployment or underemployment, trouble keeping a job, or even if you're doing well, that novelty seeking, so frequently changing jobs. We know that it can impact educational outcomes, which of course has all kinds of big picture issues. We know that it can impact relationships and divorce and money management. And, again, we talked about remembering your medical appointments, but it can be remembering to pay your bills. So there are so many multifaceted areas that, this can impact on. We've always known about higher rates of depression and anxiety. We're just now really starting to understand some of the emotional implications and, in fact, emotion regulation. We're kind of understanding it to be a key factor that goes along with the inattention, impulsivity, hyperactivity, and also understanding that different people show varying degrees of all of those symptoms, which is also one of the challenges in terms of understanding it and getting a proper diagnosis.
Some with a diagnosis might be very sensitive to criticism based on how they see their own self-value or self-worth. How does that complicate treatment?
Well, it's, again, a new understanding. What we're understanding is something called rejection sensitivity. And the amount of critical and negative messaging that's received from the outside world and internal criticism. I mean, we know that just statistically that's much higher for individuals with ADHD, but then there's a new aspect that we're starting to explore where how those comments or criticisms or perceived criticisms are then really internalized. So there can be a lot of self-blame, or it can externalize and come out in, explosive anger. But I want to make sure a key message from this is, because I still to this day hear people seeking out a diagnosis, and I'm talking especially middle-aged women, and having their physician say, well, sure, you have a job, you got through school, you've got a family, why do you need to pursue, why is it important to pursue this now? This study is highlighting why it's important to explore that might exist. And unfortunately, this is one of the areas that is still largely dependent on fee-for-service. We still, to this day, do not have great public access to diagnosis. Treatment is a whole other piece, and again, treatment should always be multimodal. It's not just the medications, although these days, again, we have a lot of orphan patients, but just finding someone who's able to do a prescription. If you don't have a family physician to help coordinate some of this, it's just that much more challenging. So to me, I look to PEI, for example, has the first adult ADHD clinic in the country, and they provide comprehensive care. So there's psychiatry, there's psychology, there's social work. We know that ideally we should be having OT and physio in there around a lot of these lifestyles issues that, this study is highlighting. So PEI has been groundbreaking. If this truly, and I mean, there's some thought that some of the conclusions, where it's a correlational study, you don't know a lot of the information. All you can do is take it from the correlation. But if even a percentage of this is accurate, I don't know of any other health condition with this level of severity and impact that doesn't have major clinics and centers